Okay, so in this video, I'm going to go through the muscles of the lower extremity, primarily of the hip. So I'm going to start with the external rotators, the short external rotators. There's 6 of them, and they kind of literally make a fan from the pelvis and from the sacrum to basically the greater trochanter. So the top part is bounded by the piriformis that comes from the anterior part of the sacrum and goes to the greater trochanter, so that's kind of your top part. The bottom is bordered by the quadrate femoris, and that comes from the ischial tuberosity to the quadrate tubercle on the intertrochanteric crest. So that's kind of your bottom. Then in the middle you have the obturator externus and internus, and the gemelli superior and inferior. The obturator internus comes from the obturator foramen membrane and kind of the inferior part, and goes to the medial surface of the greater trochanter. And then the obturator externus comes from the ischial and pubic ramus and also goes to near the greater trochanter, actually the trochanteric fossa, which is right about in the same place. And then you have the gemelli, the superior and the inferior. The gemelli superior comes from the ischial spine to the medial surface of the greater trochanter, and the gemelli inferior comes from the ischial tuberosity to the medial surface of the greater trochanter. All of these 6 muscles externally rotate. The one, a couple exceptions there are the piriformis, which can also abduct. So you can imagine if it comes from here to here, it's going to be superior to the line of rotation in the frontal plane, so it can abduct. Also, the obturator externus is an adductor as well. So it's coming from here to here, so that's coming below that axis of rotation in the frontal plane, so it can adduct as well. And the obturator externus, the nerve, is the obturator nerve, which is the nerve of the adductors. All these other short external rotators, the nerve is off the sacral plexus. So that's the one exception. So those are all going to externally rotate. So external rotation, open chained, is going to be just this. Okay, so it's when the toe is moving out. Closed chain external rotation is going to be this. Okay, so if you think about it, if you think of these muscles, okay, coming across, basically kind of across your butt in the horizontal plane, open chain, they're going to pull on the femur kind of in an outwards kind of way, so it's going to be external rotation. But in closed chain, with your weight on your foot, they're going to do the opposite. Now they're going to pull the pelvis towards the femur. So basically they're going to rotate to the opposite side. Okay? So remember, with hip rotation, that's going to look very similar to trunk rotation. Okay, so that's the external rotators. So standing on the posterior side, you have the hamstring muscles, you have the medial and the lateral hamstring muscles. The lateral hamstring muscles are the biceps femoris, and there's 2 heads, and that's going to come from, the long head comes from the ischial tuberosity to the fibular head, and then the short head comes from the lateral lip of the linea aspera, also to the fibular head. The long head is going to extend the hip. It can also laterally rotate the hip, and then it also will flex the knee. And the nerve is tibial, which is the major nerve off the sciatic that actually does the whole posterior lower extremity. The short head is only going to flex at the knee, and the nerve for the short head is the common perineal. The medial hamstrings are the semimembranosus and the semitendinosus. They also come from the ischial tuberosity. The semimembranosus is going to come from the ischial tuberosity to the posterior medial condyle of the tibia. It's going to extend the hip, and then it's also going to flex the knee, and it can also immediately rotate the hip. The semitendinosus also comes from the ischial tuberosity. It's going to insert down to the proximal medial shaft of the tibia. It's what's called the pes insularis tendon. The pes insularis tendon is three tendons, 3 different muscles that all insert into the same spot. So the semitendinosus can also extend the hip. It can also immediately rotate the hip. It will also flex the knee and immediately rotate a flexed knee. And the nerve is tibial. So those are the hamstring muscles. Over all of this is the gluteus maximus. The gluteus maximus comes from the posterior iliac crest. It comes from the edge of the sacrum, from the coccyx, from the sacral tuberous and sacral spinous ligaments. It's a large muscle that actually has 2 insertion spots because people divide it into an upper and a lower. The upper is going to come into the IT band, and that's the iliotibial tract, which is a tendinous, thick tendinous cable that comes down the lateral part of the femur. So the upper part of gluteus maximus will insert into that IT band. The lower part will insert into the gluteal tuberosity, which is kind of the lateral lip of linea aspera of the femur. The muscle as a whole is an extensor. It's your most powerful hip extensor. It can also externally rotate and abduct. The lower part of gluteus maximus, which is going to be this part, is going to come below that axis of rotation. So the lower part only can AD duct. And the nerve for the gluteus maximus is the inferior gluteal. That's the inferior gluteal nerve for the gluteus maximus. Also, moving to the lateral part of the hip are the gluteus medius and the gluteus minimus. The gluteus medius is going to come from in between the posterior and the anterior line and insert into the greater trochanter. And then the gluteus minimus is going to come from the anterior and in between the anterior and inferior lines. It also comes to the greater trochanter, but a bit more in front, a bit more anterior. So both the gluteus medius and the gluteus minimus ABD duct. And then the gluteus minimus, because it comes more in front, that's also considered a primary flexor and can internally rotate. And the nerve for the minimus is the superior gluteal. The gluteus medius, which is a larger muscle and comes more straight down, can be thought of very similar to the deltoid, and that you can, it's in kind of that lateral, it's sort of a lateral muscle. It can be divided into 3 parts. So the muscle as a whole is going to ABD duct, just like the deltoid. But the anterior part will flex and internally rotate. The posterior part will extend and externally rotate. And the nerve for the gluteus medius is the superior gluteal as well. So both the medius and the minimus are superior gluteal. Coming around to the front, you have your flexors. So another flexor, and actually an adductor as well, is the tensor fasciae lata that comes from the posterior part of the iliac crest and posterior to the superior iliac spine. And that's going to insert into the IT band again, a bit more distally than the gluteus maximus did. So it inserts down into the IT band. It is a hip flexor. It's also an ABD ductor, and it also can medially rotate. That's a tensor fasciae lata. And its nerve is the superior gluteal as well. So you have your major abductors, your gluteus medius, your gluteus minimus, your tensor fasciae lata. They're all going, they all abduct, and they all have superior gluteal as their nerve. So another flexor is a sartorius muscle, and the sartorius muscle comes from the anterior superior iliac spine, and that's going to come down and insert into the proximal medial shaft of the tibia. It also goes into that pes encinaris tendon along with the semitendinosus. The sartorius is a primary flexor. It's also a lateral rotator at the hip, and can also ABD duct. And at the knee, it's going to flex and medially rotate the knee. Another flexor is the rectus femoris, which is part of the quads group, that comes from the anterior inferior iliac spine and then inserts into the tibial tuberosity via the patellar tendon. So the rectus femoris is going to flex the hip. It is the only flexor of the quad, only flexor of the hip of the quads group, and then it also can extend the knee. Okay. So sticking with the quads for a minute, the other part of the quads is the vasti group. So you have the vasti lateralis, and that actually wraps around from the lateral lip of linea aspera and then comes around to the front. You have the vastus medialis, and that wraps around from the lateral lip of linea aspera and comes around in front. And then you have the vastus intermedialis, which literally fills in that spot. So actually, your thigh is completely covered by your quadricep muscle. And they all come into the tibial tuberosity via the patellar tendon, and the vasti group, vastus medialis, vastus lateralis, vastus intermedialis, all extend the knee. And the nerve for the rectus femoris, for the vasti group, for the sartorius as well, is femoral. That's your primary nerve of your hip flexors. So another hip flexor muscle is the iliopsoas, which is actually 2 muscles. It's the psoas major and the iliacus. The psoas major comes from the transverse process of the lumbar vertebrae and goes to the lesser trochanter. The iliacus muscle comes from the iliacus fossa, also goes into the lesser trochanter. And the iliopsoas muscle is your primary hip flexor. The psoas major is actually innervated off the lumbar plexus, and the iliacus muscle is innervated from the femoral nerve. Okay, so those are your hip flexors. The last group I'm going to talk about are your adductors, and the adductors are typically divided into a deep, an intermediate, and superficial group. So the most deep muscle is what's called the adductor magnus, and the adductor magnus actually has two parts to it. It has an extensor head and an adductor head. The extensor head is going to come from the ischial tuberosity and come down to the adductor tubercle on the posterior condyle of the femur. Its nerve is tibial, and it can extend the hip. Okay, that's the extensor head of the adductor magnus. The adductor head is going to come, is going to sweep down, comes from the ischial and the pubic ramus. It's a very large muscle, and it's going to insert into the entire lip of the linea aspera. It's a very large, very deep muscle, and that muscle is going to adduct. And its nerve is obturator, which is your primary nerve for the adductors. So the intermediate layer is the adductor brevis. So the adductor brevis is going to come from the inferior ramus of the pubis to the medial lip of the linea aspera. Its nerve is obturator, and primary action is adduction. And then you have the adductor longus, which is going to come from the pubic tubercle and go to the medial lip of the linea aspera. And then you also have the pectineus muscle, which comes from the pectineal line of the superior pubic ramus and goes to the pectineal line of the linea aspera of the femur. And then you have the gracilis muscle, and the gracilis comes from the inferior pubic ramus, and that is the third part of your pes ansinaris tendon. Okay. So, like I said, the adductor magnus is your deepest, your adductor brevis is the intermediate, and then your adductor longus and the pectineus and the gracilis are part of the superficial layer. All these muscles adduct. Most of them also have the potential to internally rotate. The pectineus muscle is also considered a primary flexor, and that's the one that comes from the pectineal line on the superior pubic ramus to the pectineal line of the medial lip of linea aspera. Is also considered a flexor, a primary flexor, and its nerve is femoral as well as obturator. Gracilis, adductor brevis, adductor longus, the adductor head of the adductor magnus, those are all the obturator nerve. And the gracilis, aside from adducting and internally rotating, can also internally rotate a flexed knee, just as all the other muscles of the pes ansinaris group does. Okay? So those are your adductors. So the adductors, like I said, also have the potential to internally rotate. And so internal rotation is going to be them pulling like this, right? So they generally all come from the pubic area. They generally all come down to the femur somewhere. So when they shorten an open chain context, they're going to pull the femur towards the midline. Okay? What happens in a closed chain context? So when my weight is on my foot, now they're going to rotate towards the same side. Okay? So they're going to pull the pubic area, the pelvis, towards the femur, the opposite. So internal rotators are going to pull to the same side versus the external rotators, which are going to rotate to the opposite side. Okay, and because we do a lot in closed chain contacts, that's an important thing to remember. The other thing to mention, a couple other things to mention, any muscle that can flex the hip, okay, so pull the femur forward in the sagittal plane, can also perform an anterior tilt, and that's kind of a short arc movement of the pelvis, as Newman calls it, so they can pull the pelvis forward. Okay, so any hip flexor can do that. Conversely, any muscle that can extend the hip, so pull the femur back in the sagittal plane, can pull the pelvis back into a posterior tilt. So that would be your gluteus maximus and your hamstrings. Another mention about the abductors. So open chained abduction, that's the muscles on the lateral side. That's going to be moving like this in the open chain context. What does it look in a closed chain context? When a closed chain context, it's going to pull the pelvis more towards the femur. So the way this is used functionally most commonly is when you go to a one-legged stance. Okay, So how is my pelvis staying up? When both my feet are on the ground, my pelvis is going to stay put. But when I go to one leg, okay, how does this pelvis stay up? Okay, it's my gluteus medius on this side, okay, that's pulling the pelvis a bit closer to the femur, that's holding it up on this side. If it didn't work, I would do this. And in fact, that's something you'll see in people who have weak abductors. Sometimes it's hard for people to remember the open and closed chain contacts. Just think about it. If I was doing open chain work on this side, what would I do? I'd pull my leg out like this, right? When you're doing exercises, so when you're doing abduction exercises, okay, bringing this leg out to the side, you'll notice after 10 or 20 reps, where do you feel it? You don't feel it so much on this leg, you feel it on this leg. And why is that? Because there's a lot more force that's being produced here to keep your body weight over here and keep yourself level. That's basically supporting your whole body weight in the frontal plane, versus the amount of energy forces being produced on this side just to pull your femur up. So that's much less weight. Okay, so whenever you go to a one-legged stance, your abductors are responsible for keeping your pelvis stable in that frontal plane. Okay, versus the external rotators, which keep you stable in the horizontal plane, versus your extensors that kind of keep you upright in the sagittal plane. And those are the muscles of the lower extremity.